This is our 22nd online webinar series, Empowered Nurse to Empower Nurse. We have two eminent speakers for this day, Dr. Renju Sosan Baby and Ms. Geeta Singhi. So now I would just like to introduce Dr. Renju Sosan Baby, the first speaker. Prashant, will you please share the slide? Dr. Renju Sosan Baby has done her PhD in nursing. She is working as the assistant professor, Department of Psychiatric Nursing, Institute of Human Behavior and Allied Science, New Delhi. Her experience and achievements. Madam has over 20 years of rich experience in the area of clinical practice, teaching, and research. She has been the organizer and resource person for workshops, conferences, and training programs in national and international forums. Madam has worked as nursing officer in CNC AIIMS, New Delhi, worked as associate professor reader at AIIMS, Bhubaneswar, worked as nursing superintendent at AIIMS, Bhubaneswar as additional responsibility. She is a national level master trainer for nurses in substance use disorders under Ministry of Health and Family Welfare, Government of India. She is a peer reviewer in Indian Journal of Psychiatric Nursing. She is also authored MOSC, Manual of Psychiatric Nursing. She is a peer reviewer in Indian Journal of Psychiatric Nursing, resource person of all international conferences and international conferences. And she has organized state-level faculty training in OSCE in psychiatric nursing in 2016 at MOSC, College of Nursing, Kolanjeri, Kerala. Now I request Madam to brief us about bridging the gap in theory and practice in nursing. She would be sharing her experience. Over to ma'am.
Hello, am I audible?
Yeah, you're audible, ma'am, but you can just, the screen is short, you can just full screen.
Is it not visible full screen?
No, ma'am.
Is it? So can you see my slides?
Yeah, we can see it, but it's in a small one. No. Ma'am, F5? Is it
yeah,
F5
but when I make it slideshow, you are saying it is
small. It's not clear.
Now I've made it full screen. Is it visible?
Just go to this next slide. Ma'am, go to the second slide.
I have moved the slide. Maybe I think this is not working. Maybe from my end.
No, it's okay, but it's small. Okay, can continue. Okay, it's where we can see.
Okay. So thank you so much, TNA Delhi State Branch, for giving me this opportunity to share my small experience of bridging the theory practice gap. So let me just give a brief overview about why there is a gap. I hope many of you may be feeling, I don't know whether you agree that there is still a gap between the theory practice. So it is not only the difficulty or the disconnect between theoretical knowledge gained in classroom and the practical experience or practical application, the real life setting experienced by the nurses or the new nurses, because of the disconnect between because many things, whatever they are taught in their college, sometimes it is quite different when it comes to actual patient care setting in hospital. So that may make the new nurses or the student nurses feel unprepared and leading to mistakes or lack of confidence, especially if there is a wide gap between theory and practice during the training. They will that will really make them unprepared and leading to committing mistakes, or it may lower their level of confidence also. And because of this gap, the opportunities for hands-on experience during the training program also remains less, and it can hinder the development of critical thinking skills. And another reason why the gap is there, and the gap may become more wider, because nowadays what is the trend is there? I feel that nowadays the nurse academicians, nowadays immediately after BSc they are doing MSc, and straight away after MSc they end up in teaching. So what happens is that nursing teachers or nurse academicians sometimes lacks clinical experience. Um, uh, so they may be entering to the academics field without sufficient clinical experience. That also can result in decreased level of confidence among the academician to teach the clinical skill when it comes to the when they come to the clinicals and teaching the students the skill. And other reason of gap is that the lack of collaboration between the academics and the clinical nurses, academicians and the clinical nurses. There is lack of collaboration, and at times both of them feel that when the clinical side nursing officers come to college, they feel lack of acceptance, and same way when the faculty goes to clinicals, they also feel that they're not being accepted like one of the team member. So these things can widen the gap between the theory and practice. So, so because of this theory and practice gap, what happens is that because in academic side the teachers may be more knowledgeable, they may have higher education, they may have more knowledge, but they may lack skill because they don't have that much clinical experience. Whereas in clinical side they have so much, they are clinical experts, but they may not have that much academic knowledge. But since there is lack of collaboration between the two, the gap widens, and it results in it really lower the when it really widens the gap, and it really act as a barrier for we don't feel that we are partners of health, the nursing fraternity. And this that is one reason. And I'll be discussing about initially I'll discuss about how to bridge the gap, then I'll share my experience, which I'll share my personal experience. So the strategies to bridge the gap is, first and foremost, is the effective communication and collaboration between the nurse educators and practicing nurses. So how can we have because unless and until we have a good collaboration and good communication between each other, we can't bridge this gap. So we have to establish open lines of communication. Nurse educators, they'll gain their valuable insight into by having this good communication. Nurse educators will understand the challenges faced by the practicing nurses, and the practicing nurses also will get more exposure to the area of knowledge. So the collaboration between the nurse educators and practicing nurses, it helps to build a sense of partnership, where both of them feel that we are partners in this patient care, and we both the parties will contribute actively. So by conducting regular meetings, workshop, and shared learning experience, it will help to provide opportunities for mutual understanding, trust building, and professional growth. So other strategies incorporating hands-on learning experience in nursing education program. So when the institution where they don't have a good parent hospital, they can at least have a good simulation lab there, or they can have simulated patient care scenarios or clinical rotation for safe environment for the learners to gain confidence and proficiency before they encounter the real life experience. So this simulated setting, using good quality simulated scenarios, the student will have a better experience, and they'll be having the confidence to face a real life experience. So incorporating hands-on learning experience in the education program is one strategy, and other strategies, having a concept of clinical preceptorship or implementation of the clinical preceptors. So the clinical nurses who can become clinical preceptors, and these preceptors can be involved actively in teaching the students. So this clinical preceptorships also will provide a structured transition period for students, and it will this preceptors will help them to uh, learn the hands-on skill in the real life patient care setting. And other strategies to bridge the gap is implementation of dual role in nursing. We all know that 2019 Indian Nursing Council brought the resolution and introduced the concept of dual role in 2019, where the faculty from College of Nursing will have responsibility in the service side. They'll be taking up the roles as maybe nursing superintendent or deputy nursing superintendent, assistant nursing superintendent, as well as the clinical nurses will be involved in teaching the students in the college as well as in the clinical side. So we know that dual role is an excellent method to bridge the gap, and we know in CMC Vellore, an institution like CMC Vellore, it is practiced for long. It was there in NIMHANS for long decades, and we in private scenario, St. John's practice this dual role model, and it really helps in bridging the gap. And in Delhi, if I say in a new institution like Amrita Faridabad, they have this dual role concept. And many AIIMS, they have the concept of integration, which actually not a pure dual role, where the nursing faculty has been given additional charge of administration as the nursing service there in the beginning, because it's new institution and it will take time for the nurses to get promoted to the administrative level. So as a supplement mechanism, they used to start this clinical integration model. But that may not be the actual dual role that the INC is proposing. So dual role also will help to bridge the theory practice gap. That is the ultimate solution is to implement the dual role, but it has its own difficulties and challenges to implement that we all know. And once if the dual role of nurses once it is implemented, we know that it will elevate the quality of patient care and the standard of nursing itself. Because we'll be able to accept each other, because we'll be sharing the same responsibilities in both the service and the academics. And this good interpersonal relationship with the healthcare team will help us to give the best learning experience for the students also. And once the empowerment happens in both the side, both the academic side, also the teachers will get more opportunities to practice the clinical skill, and the nursing service side also they'll get more chance to teach the students, and they'll be getting the chance to strengthen their academic side. And both of them will get mutually empowered, and it will help to enhance the student learning as well as the quality of patient care also. And other strategy to bridge the theory practice gap is fostering the culture of lifelong learning for nurses in clinical practice. We know that nowadays the trend is improved. Nowadays what we can see is that majority of the students after completing the masters, they get into NORCET and they work as a clinical nurses. So and the in-service education also, the nurses after completing 5 years of service, they're being given a chance to upgrade themselves, upgrade their knowledge, pursue higher education. So many of them are doing post-graduation, they are doing doctorate in nursing, as well as many are even doing postdoctoral fellowship. So this culture of lifelong learning for nurses, especially in clinical practice, it has to be fostered. And nowadays we can see the difference. They are getting themselves educated, and it really enhance the quality of patient care, and it also helps to bridge the theory practice gap. And the faculty also should get opportunity for developing clinical competency, because many of them are entering into the academics, they may not have adequate clinical skill. So they should be given clinical competency development opportunities also, so that both the sides they can be strengthened, so that ultimately the students are benefited and the student nurses are trained well with the required knowledge and skill. So now I'll be sharing my experience. How was my journey? How was my almost, Madam told 20, I don't have 20 years of experience. My journey is 18. I have 18 years of experience in total altogether in nursing. So from after completing my graduation, I was working in AIMS New Delhi as a staff nurse. And in the year 2007, I completed my master's and I joined academics. So I joined as a senior lecturer in MOC College of Nursing, Kerala, where I was there for almost 10 years. And my journey for this bridging theory practice gap, I'll share. So initially, the institution where I was working, they were having the diploma program. So for them to accept the College of Nursing and the College of Nursing faculty, it took time. So we were having that lack of acceptance immediately, because suddenly postgraduates are coming and teaching, and so there was a bit drift, and that drift was we could overcome the drift in 1 or 2 years. Then slowly from the hospital we started getting acceptance. So but for me, at least for 3 years, I really took to break the ice. So 2007 to 2010 was, I will explain as an ice breaking period, because that 3 years, that really took them to accept me as one of their team member. And they will accept me, or they started accepting me only when I started giving more of myself, my time for them. So when initially when I used to go with the students, I used to spend time from 9:15 to 1 o'clock in clinical side, teaching the students and having a good rapport with them. That was not sufficient to break the theory practice gap. So I understood that the service side, the nurses they were very skillful, but they were not having that much knowledge. So then I started training them. I started maybe almost with the permission of the principal and the nursing superintendent. I started taking class maybe for 25, 28 lectures. I used to take for almost 40 nurses in 3 psychiatric units. So around they'll 4 phases I have to train to cover the entire nurses, because they are working in shift. So maybe it took me almost 1 month to train the entire nurses who are working in psychiatry. And I trained them in a such a way that my nurses will be, they are all disease wise, medication wise, all aspect. I gave training, whatever knowledge acumen I was having, I started sharing my knowledge. I started teaching them. And after teaching them, after training them, I could see a sea change. Once they are trained and once they are fully equipped with knowledge, they started, the involvement that they showed to teach my students was immense. So then we used to take our rounds together, all the discussions, all the presentations, that the student assignments, whatever we used to do together in the nurses station. We make all the students to present in the nurses station. The nurses used to give feedback. The in charge used to give feedback. So I used to hand over my students, and we used to learn together. We used to grow together. So once there is an active participation, I felt the nurses started becoming very empowered. They're very knowledgeable. Even the doctors used to say, Kiranju, I'm really scared to take rounds with your nurses, because your nurses ask so many doubts. So then I used to feel very happy. That was my success, because once my nurses started becoming very knowledgeable, they used to, our patient care, we could see see change in the patient care. They used to give so much of time in educating patient, and the students are actively participated in the learning, and they used to prepare the nursing students in such a way that at least they'll be able to practice. So so they make the students to do everything what the nurses are doing under their supervision from admission to discharge. They actively involve the students in all the activities. So then slowly we started thinking that and since it's a private hospital, the turnover rate was very much. So the nurses keeps on changing. So it was difficult. It became very difficult to take multiple repeated session all over again and again. Then all the service and the faculty together, we started making SOPs. So we started making SOPs for admission, discharge. Then we started disease specific SOPs. That is the image that I'm showing you. We started making SOP from admission, discharge, the responsibilities, of nurse during, everything, disease wise, depression, what they should do, mania, how they should do, from admission, what all activities. So the student as well as a nurse who are coming to the psychiatric unit for the first time, they just need to look at the SOP and they have to follow, and they learn everything. So this SOP is prepared jointly by the faculty, the nursing officers. So each the in charge will say that you prepare SOP for this topic, and they will, during the night shift or evening time, they will take some time out and they will give me the points, and I will refine it. And we finally made this SOP, and we used to give this SOP for validation to the psychiatrist. So this manual and this book not only had this SOP, but also so many theoretical components the nurses, the students, as well as the staff nurses should know, so that they'll be very well adjusted to the psychiatric setup. So this for by 2014 we started making SOPs, and by 2017 we could release this manual officially. And after, once we because of this theory practice partnership, the academics and service partnership, the nurses were empowered, and the nurses took so much of interest and enthusiasm in training the students. And the students used to say that after passing out from after having the psychiatry posting from this particular ward, they can work as a staff nurse with much ease because they are trained everything. So that was my that was my biggest experience, how after bridging the theory practice gap, how an active collaboration will facilitate the student learning as well as the nurses empowerment. And afterwards, then I got a posting in AIIMS Bhubaneswar. There I got, this clinical collaboration continued. We started the same in AIIMS Bhubaneswar also. Then when I got a chance for this as a nurse administrator, as an additional responsibility, when I was working as a nursing superintendent, this strategy really helped me, because I have to, I started working with them. I have to make them feel that I am one of them, and my commitment towards my profession. So then once they start accepting me as one of their team members, and then we started learning together, we started doing so many activities together. We started conducting clinical conferences where all nursing officer, they'll prepare and present the cases, and they will learn. And we started making SOPs ward wise. We used to make SOPs, and we have done so many things. And this in turn, this active collaboration bridge or minimize the theory practice gap, and the students were the ultimate beneficiary, because when they go to the clinicals, and because of this good active collaboration, they'll get the maximum hands-on experience from the hospital side. And the clinical nurses, we used to do journal clubs. We used to do this during this journal club, or during the CNE club, every Tuesday 12 to 1 in Department of Psychiatry. The nurses used to take classes for the students. The MSc students used to take, the faculty used to take classes. So when the nurse are actively, they are taking classes, means they'll be sharing their experience. There was rich clinical experience, and that really helped the students to learn. So the active clinical collaboration and good licensing, and that is a strategy by which we can actually bridge the theory practice gap. And that was the small effort and initiative that I have done from my part, because we can't, institutional collaboration, that may be beyond my hand. Whatever I can do as a nurse, and that I have done, and I am sure that those strategies will surely help to bridge the theory practice gap. So in this year, I joined IBHAS, so where we don't have students per se. Next year, we'll be starting the master's program. So now my initiative, my effort is on empowering the clinical team. So even though they are very much senior nurses, but we are giving specialized training program, and we are empowering gradually, and so that the gap between the academics and the service has to become minimized. And once they are properly empowered, when my students, when the master's students come, I'm sure they'll be able to learn the best. So that is how that is what I want to share. My experience of bridging theory practice gap. And since the time is, I think it is almost 25 minutes and only 5 more minutes. So I would like to conclude by saying that whatever change that you want to see in our nursing profession, we ourselves have to become that change first. So the journey to bridge the gap, theory and practice gap, should start first from you. Then you can expect others to change. So let us be the change agent, and let us do it, and together we can do it. Thank you.
Thank you, Dr. Renju. I am Dolma here from TNA Delhi branch. Dr. Renju has very beautifully summed up in a very concise way with example from her own professional life, how to bridge the gap between theory and practice, starting with why there is a gap, where she has highlighted a major 3 points that what we learn is not getting implemented in clinical. And second, there are certain thank you. And second is she has also shown concern on the clinical inexperience of the academic faculties, and also lack of collaboration between the academicians and clinicians in our nursing. So this we have to think, and this is really a great concern, and she has really very well put up the points. And also she has talked about how to bridge the gap, wherein she has highlighted on the communication to collaborate between the nurse clinicians and the nurse academicians for shared learning, and also hands-on learning experience, importance of hands-on learning experiences. Then having a culture of clinical preceptorship, and going for the dual role, importance of dual role also. And we should develop a culture of lifelong learning in nursing, and academicians also to and have the improve the clinical competencies. So these are very important points which Dr. Renju has highlighted. And at the end of her session, she has very beautifully shared how she walked the talk, and with an inclusive approach, with passion, dedication, and consistency, how she has achieved bridging the gap, not all gap, but then she has tried her best. So, and at the last also, she has very beautifully said that it should come from us. And I would like to add on with what she said is, let there be change in nursing and let it begin with me. So, ma'am, thank you so much, Dr. Renju. I will request you to be here for the next session also, because after that session, then we'll have the question and answer session. Thank you, Dr. Renju, for this lovely talk. And I would give the screen to now Bindu Shaju ma'am to introduce our second speaker.
Thank you, ma'am Dolma.
Bindu ma'am, are you able to?
Yeah, she is there. She is there. Yeah, it's my privilege to introduce the speaker for the next session. That is Ms. Geeta Sinha. She's a nursing officer in JPN Apex Trauma Center, AIIMS, New Delhi. And she has experience of, she's a certified trainer, NTP, National Triage Implementation Program of India. She's also a certified trainer of trauma system and mass casualty management. She's an ATCN instructor. She has also done her ATCN instructor course and the provider course. She's certified national trainer in simulation education and research, quality audit and quality improvement training. Also, she's done from MSME Technology Development Center. She's a core committee member of WHO Collaborating Center for Emergency and Trauma Care in Southeast Asia. She's also a member of WHO Center of Excellence for International Network of Critical Ultrasound, Emergency Medicine Association of India, ISECN, that is Indian Society of Emergency Cardiac Nurses, and several other international and national bodies. She's a resource person. She was a resource person for many sessions for workshops, conferences, and training programs in both national and international forums. Also published and presented research papers in the national and international forums. And she has also to accredit awards and honors. She's a fellow academic clinical emergency nursing in India, Aimsonian of America Book Prize Award for Best Nurse in Research Work in 2014, and awarded for establishing emergency care system in tribal rural primary care setup in Gadchiroli. And also she has been awarded for, establishing a standardized crash cart at 33 medical colleges of
UP and also trial system at 33 medical colleges of UP. We're really glad to have you, Ms. Geeta, with us to take this session. I hand over you the session.
I'm audible, ma'am.
Yes, yes.
So thank you so much, ma'am, for the nice introduction. And good evening to everyone. And first of all, I really thanks to ma'am, Susan ma'am, very nice lecture, because whatever you taught, ma'am, we really using a practical. We are doing all these things, whatever you explain. So thank you so much, Susan ma'am. Now let me start. First of all, good evening to everyone. I'm Geeta Sinha, working in a Jayaprakash Nair Epics Trauma Center as a nursing officer. So today I have been assigned a very important topic, that is a creating leader of change. So that is a very important topic. So what does mean the leaders? What is the meaning of leader? So leaders are those who take a lead from the front, and they take a good qualities from their team members and an approach for the good result. But the manager manage the work, and he only expect the outcome. He work only for the outcome. So you can see there are so many leaders we know. Everybody aware about all these leader like Gandhi ji and Kalam sir. So, and one are from nursing fraternity like Nightingale Foreign. So they are the great leaders. What they did? They choose leadership, not a position. Leadership is their choice, not a position. They use this leadership. So what is the gap? Already Suzanne ma'am explained about the gap between our leadership, our clinical, and our knowledge part of nursing. So there's a gap between the clinical nursing and the leadership, because clinical nursing are the main caregiver, but the leadership are different. But what we want the clinical nurses should be play as a role of leader. We just want they have to become a leader with their clinical expertise. So we have to close that gap. So these all beautiful ladies, great ladies. As anyone know about them, you can write in chat box. Anita Dore, Madam Anita Dore, Madam Bessie. I will be very happy if anyone can say anything about anyone of these leaders. If any idea, you can just write in the chat box. Actually, we should know. After about all this leader, you should be feel very proud.
Geeta, can you
They're amazing leader. They were great leaders.
Hello, Geeta.
Hello.
So your
Yes.
voice is little bit cracking. So I'll advise you to put off the video.
Okay, ma'am.
Yeah. I think it will be better, the sound. Sure.
So first of all, anybody know about them? They all great ladies are from our nursing department. They all are nurses. They all were nurses. What they did? Anyone knows? They did a great job. They did a great thing for the patient, for all of us, for nursing procedure, for the patient care. Anita madam invented a crash card. Can you imagine? A nurse invented a crash card, which we are using nowadays, which we are doing organization of crash card we are using to manage the resuscitation, to save the patient. What about Bessie ma'am? She invented a feeding tube. Can you imagine? And Ellie ma'am, she invented a colostomy bag. So all these things we are using nowadays for the patient care. And all things were invented by these great ladies. So now Now you are feeling proud? Yes, we all are feeling very proud. As a nurse, I'm a nurse, I'm feeling very proud because we are the change that we see. Because what they thought, if they want to do change, they should start from us, and because we are very powerful and we can do this. So now let's start a journey from clinical nursing to the leadership. What we did, we start an emergency care improvement program at Uttar Pradesh. As you know, the population of UP, you know, everyone, 25th person in world is from the UP and 5th in from the India. So you can imagine how much population of the UP, and if we do some implementation, if we do something for the patient care, so how much patient care will improve in UP? You can imagine to about this population. As earlier, the baseline of the UP is very pure because they have no system. There's lacking of protocol. There's lacking of system building, and they have less knowledge. So less skill and knowledge. But this is a baseline structure of the UP. So then we started with our team, the Sata Sanjeevani program, tried implementation program with the 33 medical college of the UP. So what we did, we created a champions from our nurses. So we created a champions for our nurses for this UP program. So we'll start mentorship journey. We take a session of mentors first, then we assign the facility of them, then we start the implementation program. So that is a 100 days program. We started a TRIAGE implementation program for UP from 1st August. First, we did mentorship session. We created 11 mentors from this for the UP session. You can see here, we implement this UP TRIAGE program step to step, like we building a team, we create a mentor from the nursing fraternity, we connect the team with the baseline, then we took a data, then we start a TRIAGE implementation program. Still it's going on with our nursing leader. So you can see this, still there's some glimpse of the training program, master trainers of UP. We did the mentor session for them. You can see here some offline training program for the UP nurses, with online and offline both training session for the UP by the nurses. So impact, you can see the impact. In impact, the impact of the TRIAGE program in UP is there is 100% TRIAGE area in all medical college in our hospital. They put a dedicated TRIAGE nurse for the emergency. They start the TRIAGE documentation, that is 100%. Now we are working on the quality that is going on. So thanks to my team and member of the UP that create a good TRIAGE. Now come to the next my journey, that is I think audible, Dolma ma'am.
Yeah, Geeta, can you do one thing? एक बार ना स्लाइड शेयर बंद करके फिर दोबारा कर दो, क्योंकि ना somebody is scribbled on the screen which is disturbing. कोई मोबाइल पे वो कर रहे होंगे, है ना?
Okay मैम.
थोड़ा सा आपका वॉइस भी बीच बीच में क्रैक हो रहा है, but we can't do anything on the network. हाँ, आप दोबारा शेयर कीजिए. स्लाइड शो कर दीजिए.
Now I'm audible.
हाँ, या अपन ना वॉइस इज ऑडिबल, बीच बीच में थोड़ा सा वो हो रहा. यू आर ऑडिबल गीता, यू कैन कंटिन्यू.
Okay. Okay ma'am. So that felt me as a powerful woman, because now I am a powerful woman, because this journey I have started in COVID when I got COVID positive 3 times, and that time I was in maternity leave. So maternity leave is not a liability but an asset for me. What I did a nurse initiative. With my team, I have created this teaching initiative in the tribal area search, which is located in the Gadchiroli of the Maharashtra. The search nurses are not certified nurses. Some are some are nurses, some are just computer course they did. They are not nurses because the leader of the search, what he started, he took a tribal girls and started nursing and provide the nursing to them, because nobody wants to join the tribal area as a nurse or as a doctor. So what we did, we started training of the nurses of search were online. So you can see here, we start online skills session. We took a lecture, we took online discussion, meeting, and you can see in front, she is a search mentor. What we created, again, we created a mentor leader for the team. That is leadership, and all leaders are from my clinical nurses, because they know for what we have to do for the patient care. So again, we started a leadership journey for my clinical nurses. You can see what we create a structure for the search training. We just assess the need-based training. Then we start the continued training, and we used certified trainers. Content was standard, and the cost-effective teaching, and thus improve impact the assessment interactive session. The session was very interactive, and this was regular skill-based session. And you can see in the trial area, they started triage. You can see they started triage with the triage register with and documentation. Although they are not certified nurses, but they learn this start documents. You can see the graph. They triage 36 red area patient and 25, the 24 is the yellow, 8 are the green. So you can see also they start practicing nursing through the simulation. You can see the manual for clinical learning. They start to organize their resuscitation area, their emergency department. They start to use a knowledge in patient care. VIP scoring, they learn the VIP scoring, and they start to use there in the documentation. So the impact and scale of the program is only the COVID-based opportunity that we took 2 years training for the 200 hours. We created a 10 trainers, and we trained more than 20 nurses of search. The another impact, that is my lovely search nurses. Now they are the leaders. Again, we create a leader in the search, because for the system sustainability, we need a leader, locally we need leaders like the search nurses, because we can't go there for the regular teaching and the practice. We need some leader from their side. So again, we created a leader from the search nurses. These 4 lovely smiling girls are from the search team. They did the training of the TOT training, and now they are the trainer for the search. What our team used? We used humanistic approach. I started to trust on them, because online teaching is very difficult for me that time, COVID time, because this is the first interaction for all of us, because online teaching came on that time, COVID time. So what we did, basically we start to trust on them, and we use humanistic values, human values. Like I used to respect them. I try don't hurt them, because everybody think we are from the AIMS and we are the AIMS background. So, but I try to give respect to them. Vibration and connection. Now we have good relation with all of them, and still the training is going on with the search trainer. Next program is our NTP program, National Program. So we about for the patient, the 3 R is very important for emergency. That is a recognize, resuscitation, and the referral. So first very impactful and cost effective is a recognize, that is a triage. And telling that it is no national program and Triage team. What we did, we created a leader for the Triage training from the nurses. We are doing Triage course for nurses by the nurses. And nurses are not limited only in the aims. We have so many nurses that go international like we have from the aims, we nurses RMO hospital, from the GTB hospital, from the Thailand. So we make a group of the all nurses. So that is, we did a training in Jaipur, Triage training by the nurses. We did a training program for the Jammu nurses, this training for the Jammu nurses by the nurses. And now we implemented Triage program in Kerala state and in the UP state and the Rajasthan state. So this is the Triage program. Till now, we did total 76 workshops and created 3,448 participants, and we made 300 trainers for the Triage. See, 300 trainers are our nurses. We are regularly doing training of trainer. That is a TOT. We regularly doing the training. We are doing the training of the trainer. Like for example, for me, I have to go on the training of the trainer. And this time we first did this virtual training hybrid model. We use. We did TOT program online and offline both. That is a hybrid model. For the search nurses, we did hybrid model. For the Jodhpur AIMS, our two mentors are from there. So they did the hybrid training, and one from our Maharashtra and UP. So we did offline, that is a hybrid model for the training of nurses as a trainer. Next, a unique program is a AUTLS-N, which we are doing advanced ultrasound trauma life support for the nurses. You can see nurses are doing the scan on the bedside. They learn the ultrasound to just resuscitation the patient, to just triage the patient, and that help in the patient care. So they learn. And what we did, again, we created a leader from this program. We created a leader who took a leadership for the AUTLS-N. Ultrasound course for nurses, by the nurses, for the nurses. That is the leadership by the nurses. Next is the simulation. The simulation also ma'am explained this and the key teach of the clinical nursing. So simulation is for leaders. For that, simulation is a great part to teach the nurses about the clinical teaching. So we did the simulation training for the nurses, and also some our nurses are taking a leadership from the. We also did a nurse learning the CPR through online. So we did simulation program because she is from Arunachal. So we can't go there and she can't come here. So we did the online simulation practices. Now the story not and we develop center is create a lot of nursing initiative. We nurse I just one thing. Now, what next? See, this is the next. The WHO has created nursing global and happy part of it. Very recently, WHO has launched 25-25-25 campaign that says to train 1,25,000 nurses at least in 25 states by 20. Is a 2025 campaign. So I see all your support, and please join us to start for the nurses. At last, but not want to forget, this is very important, to gratitude my mentor, I just say thanks to my mentor who always gave us ample of opportunities, and to my senior sisters, my senior admin charges, and the ANS ma'am, who always put us in a comfortable zone. So that because of they are teaching a lot. So vision without action vision has vision. When you start action, that without action is the hallucination. So as for the vision, we have to start action. This is the evolution role of a nurse. As a leader, clinical nurse, manager, everything. Because nurse has a power. Why? We all are powerful in a healthcare system. Because in healthcare system, 60% are nurses. Can you imagine? In healthcare system, we are maximum. So why not we can become a leader? We can. Because we are a homemaker of the institute of the hospital, and we can become a leader. We have the clinical skill, we have knowledge, we can become a leader, we can teach, we can learn, we can perform. So that is the evolution role of a nurse. So I want to say all my nurses are very powerful. Either they are clinical nurse, or they are academy nurse, or they are the manager. We all are powerful, mainly working on the patient. So as Susan ma'am said about her talk, same I just want to share, ma'am. We also are working on the collaboration and the team, because in a team, when we doing the patient care, we need a team, doctor, nurse, hospital attendant, everybody we need for the patient care, to save the patient, to operate the patient, to do the patient care. We need a team. So we are working on a team. We are working on a cohesion. We start integration of a team. So this is the last not least. We all are person. We have not committed my limit myself. We are committed to pass knowledge to all. This knowledge should be passed to all, learn to all. Please try to become a leader, but with knowledge, with skill. Thank you, ma'am.
Yeah, thank you so much, Geeta. Timely presentation and a very wonderful experience sharing. You have started with saying leadership is a choice and not position, and you exemplifies it. I know you as a person who has always walked this talk and always, hold the leadership, practice leadership with a very humility, a great humility. You have always been leading people and empowering them. So thank you so much for this talk. And you very rightly raised concerns of the lack of leadership in clinical nursing. And at the end, you have said that vision without action is hallucination. Very beautifully said, Geeta. And it is, I'll also use this line now more often. Kyunki in clinical nursing, we do say we don't get opportunity. I mean, ye hona chahiye, wo hona chahiye. We do say that, but then nobody is taking efforts. So it is a lesson to everyone today hearing here, present in this room, to please see that you should take some kind of actions, and there are no lack of platforms. Lots of platforms are there. You can get in touch with WHOCC traumas team, TNAI, everywhere there are lots of platforms wherein you can empower yourself and be a leader and make changes. And Miss Geeta has also shared the beautiful journey of performer to leader, and about the UP 33 medical colleges, how you have implemented TRIAGE program and the impact of it, how you have shared. And very emotional as well as very inspiring. I have seen that journey, yours journey, of during your maternity leave, how you have led that structured tele tribal teaching initiative to the search people in the remote area of remote village of Gadcholi, where you have shown the beautiful pictures of empowered healthcare workers there, and how I'm very fortunate to hear them. Actually, the search nurses, they have presented their teaching programs, and also it is very heartwarming to see them present. Up to that, pehle unko kuch nahi aata tha, and then they don't have any platform, and now they are presenting in the webinar what they are doing. So it is very nice to see empowered nurses through your and your team's effort. And one important thing you said, that you have created impact through trust and human values, which for the nurses is very, very important. The human values factor, which is lacking these days. We have observed, I am into this profession for the past 2 decades, and I am seeing the deteriorating human values in our nursing, which we must, take a stride and then improve it from every area. And the impact of 3,448 participants with 300 master trainers your team has developed. This is huge. Everyone. And if any of the person in this webinar wanted to chip in and do something, make a change by yourself, by getting in collaboration with them, please get in touch with us. We'll connect you to their team. लास्ट में ग्लोबल नेटवर्किंग पे आ गया, देखो कहाँ से कहाँ पहुँच गया. Now I know that they got opportunity to share their experiences international platform also, which she has not shared, I think, in the presentation. So this is what your genuine initiatives. You don't have to ask for opportunity, you will get it if you are genuinely doing with good intentions. And in the group also, some of the mentors are also present in this webinar also. Siring is there, I could see, and other people might be also there. I don't know their name actually. And this is a very nice 25-25-25 campaign. So if you join WHOCC Trauma Center, there are opportunities are there, sky is the limit. So if anyone is interested, please join with them. And we as a nurses are empowering each other and showing what we can do. We have lots of potential. And thank you so much, Geeta. And lastly, the last slide is very important, which she has shown, the gratitude slide. Every one of us must know how to show gratitude to people who have helped you in developing in your profession. So thank you so much for all these lessons, Geeta. Thank you so much. Now I think we'll go for the question and answer. Do we have time?
Dolma ma'am?
Gigi?
Yeah, you can take, Dorma, you can take the question. I think 2-3 questions are there.
Dolma ma'am?
Gigi? Yes. Yes, Geeta.
Dolma.
Yes, Geeta.
Ma'am, if you have time, I just want to share little story to all, ma'am, because I really want कि जो मेरी nurses है ना, they should empower, they should get motivated, ma'am, because
Yeah.
everybody said कि we are in toxic environment. Toxic तो सब जगह है, professional personal life में toxic सब जगह फैला हुआ है, but we can avoid all this thing. So can I share a little story, ma'am?
Ji, please go ahead.
For all, ma'am, actually, I will speak on a Hindi because it's a very touchy story of Gandhi ji. So actually, Gandhi ji, जो गांधी जी का आश्रम था, वहाँ पे सब लोग आते थे और अपनी प्रॉब्लम डिस्कस करने आते थे. सो एक दिन एक लेडी आई अपने बेटे को लेके, उन्होंने गांधी जी को बोला कि गांधी जी की इसको मीठा खाना छुड़ाना है, ये बहुत मीठा खाता है, इसको मीठा खाना बंद करवाना, आप प्लीज इससे बात कीजिए, इसको समझाइए, ठीक है. तो गांधी जी बोलते हैं ठीक है माता जी, आप मेरे पास आफ्टर 45 डेज के बाद आना, ठीक है. वो सोचते हैं कि मैं किसी काम के लिए आई, इन्होंने मुझे अवॉइड किया, मुझे वापस भेज दिया, 45 डेज मेरे वेस्ट करने के लिए मुझे भेज दिया. वो फिर भी जब उसका कोई ऑप्शन तो होता नहीं, वो चली जाती है. 45 डेज के बाद अपने बेटे को लेके आती है, तब गांधी जी को बोलती है. फिर गांधी जी उसके बेटे को समझाते हैं, बात करते हैं, एंड देन उसके बाद उसके बेटे में इंप्रूवमेंट होती है, मीठा खाना वो कम कर देता है. अब बताओ, वो सोचती है कि इन्होंने पहले ये काम क्यों नहीं किया, 45 डेज तक मुझे मेरे बेटे को क्यों छोड़ा, एंड इतना टाइम वेस्ट किया, क्या जरूरत थी? एनीबडी नो? किसी को, दीदी ऑडियंस में से किसी को
गांधी
पता
जी
है?
खुद मीठा खाता था, so he could not avoid it.
Yes, thank you so much, ma'am. This story is very inspiring, ma'am. Actually, गांधी जी ने उसको वापस भेजा, क्यों? क्योंकि गांधी जी खुद मीठा खाते थे। उन्होंने सोचा मैं खुद खाता हूँ, मैं इसको कैसे बोलूं कि मत खा भाई। पहले गांधी जी ने 40 डेज मांगे, खुद मीठा अवॉइड किया, उन्होंने स्टॉप किया खाना, मीठा खाना बंद किया, फिर उस लड़के को बुलाया समझाने के लिए। सो हमें दैट इज अ लीडरशिप एक्चुअली। मैं ये बताना चाहती थी, सी दिस स्टोरी, जो हमारे पहले के लीडर्स थे ना, उनका यही था परफॉर्मेंस, तभी उन्होंने इतना कुछ अचीव किया, इतने लोगों से मोटिवेट हैं इसलिए, बिकॉज दे आर एक्चुअल लीडर। सो फॉर माई ऑल नर्सेज, हम लोगों की नर्सिंग प्रोफेशन में बहुत कुछ होता है, एवरीबडी फ्रस्ट्रेटेड, हमारी कोई वैल्यू नहीं है, कोई हमें पूछता नहीं है, बट यू कैन गो, यू कैन बिकम अ लीडर विथ योर नॉलेज एंड स्किल। सो मेनी प्लेटफॉर्म आर देयर, पहले नहीं थे बट आज बहुत कुछ है। एंड आपको मैंने हिस्ट्री बता दी है, सो मेनी ग्रेट नर्सेज वर देयर जिन्होंने इतना सारा इन्वेंट किए हैं, they all वर नर्सेज। तो व्हाई नॉट वी? हमारे पास तो सारे प्लेटफॉर्म है, सब कुछ अवेलेबल है अब तो हम क्यों नहीं कर सकते? So I request to my all clinical nurses, come with us, and we'll start a emergency care nursing by this campaign 25-25-25. So this is this is a platform for you, all of us. Let's start to become a leader.
Yes.
Thank you, ma'am.
Yeah, thank you so much, Geeta. And I would add on it that it is not that easy as you may find it. There are lots of hard work put in this thing, kind of training programs and all. So you need to have a dedication and commitment. ये एक बहुत जरूरी है, dedication and commitment होना बहुत जरूरी है. Then you can join. There are lots of platforms are there, so please contact us. We'll get in touch with we'll get in connect with the teams whichever area you are interested in. So I think questions कुछ दिख रहा है मैम? बिंदु मैम, questions?
Yeah, I think there are questions. 1 second. Yeah.
Siring is saying that these days bedside teaching or on-site teaching is not seen for the students. So yeah, it is knock to the academicians that bedside teachings has to be maybe it may be the institute specific. It could be some institute may be giving bedside teaching properly, hands-on teachings. So we can't generalize it, but then yes, there are many institutions where bedside teaching is not happening. So for that, it is very very alarming actually for nursing. Without teaching students hands-on practice nahi hai, to it's a difficult thing. So yeah, academicians should give importance to the bedside teachings as well. और कुछ दिखा बिंदु मैम? क्वेश्चन?
I think they are just comments like but not a question. And somebody was asking about guidance to join in basic emergency care training program.
ओके हाँ, एक गीता अपना ईमेल एड्रेस या नंबर कुछ शेयर कर दो इसमें चैट बॉक्स में. यू शेयर योर फोन नंबर, then later on you can connect to the appropriate person in WHOCC. ठीक है? So if anyone is interested in emergency care nursing, then you can just contact Geeta. Just put a WhatsApp message in this number. शेयर कर दिया गीता? फोन नंबर शेयर किया? Yeah, okay.
Yeah, I'm doing.
Yeah, okay. So and Renju ma'am, where is Renju ma'am? Yeah, Renju ma'am. So it was nice, really very nice to hear you ma'am, and lots of impact you have shown by such individual efforts only can bring changes. ऐसे एकदम से जादू नहीं होगा नर्सिंग में. Small in small corner of this world are doing something, making changes, and then collectively the impact will be there. So thank you ma'am for joining today here, and thank you Geeta for being the speaker here from the clinical side today. I think we can wrap up. Lots of appreciations are there in the chat, so no need to, go through those. Thank you everyone for patient listening and active participation. Very active participant Jyoti, I have seen lots of messages. Chiring is giving lots of messages. So thank you so much everyone for this active participation, and we'll meet next month. And I thank the headquarter team led by Prashant for our support every time. And Prashant, okay, those who were complaining that last month's certificate they didn't get, actually headquarter team was very busy for the couple of weeks, so that's why Prashant has not mailed last certificate. He will be doing soon, and this session also you all will be getting, though it may get little late क्योंकि बहुत सारे काम है तो इसको adjust करके करना होता है ना, so that's why please have patience. And अगर 2-3 हफ्ते में नहीं मिला तो then yeah, contact us in WhatsApp, then we'll see कैसे करना है. Okay, so and it's sure that you will get it, the certificates also you will get it. More than that, I think the inspiration you get from this platform is huge. So I always get, every month I get an inspiration dose from all the speakers in this platform. And I thank my TNA Delhi branch team, President Dr. Gopi, Shaini Chako, Secretary, Bindu Ma'am, Bindu Shaju, the Chairperson, Education Side. So thank you so much, everyone. And Kala is also
Today our
here.
treasurer has also joined.
Yes, Kala, that's what I'm saying. Kala is also here. She is our treasurer, without whom most of the time we are a little bit, so thank you so much, team. And
thank
thank
you,
you,
everyone.
headquartered in everyone. Yeah, thank you so much.
Bye-bye.
We are on time.
Thank you,
Thank
ma'am.
you.
Thank you so much, ma'am.